We all have this inherent thing that we trust doctors and nurses that they know what they're doing. But this mistake occurred right under our noses, that the nurse didn't bother to look at the dosage on the bottle. It was 10 units that our kids were supposed to get. They got 10,000, and what it did is it basically turned their blood to the consistency of water, where they had a complete inability to clot. And they were basically bleeding out at that point.
He had a small cyst on this side of his face. The doctor referred him to an ENT doctor who recommended that the cyst be removed. On the way home, we already noticed that he started to bleed, and the bleeding was profuse. They said that we have to bring him to the emergency room because of the amount of blood that was coming out. Plus, the cause of that is the one of the artery, I think, was cut. So they have to cauterize it, but they have to put him to sleep. The next thing we noticed when we were waiting at the lobby, at the hallway, was there was a code blue. The tube was not placed on the right place where it should go.
My daughter, Taylor McCormick, should be alive today. Because of medical errors, she is not. At 13 months, Taylor was brought into an emergency room of a prominent Boston area hospital because of fatal complications with a shunt that was placed in her head at birth. I was told Taylor's condition was emergent and that she required immediate surgery. However, the emergency room staff informed us that her surgery would have to be bumped from that evening to the following morning. They told us the operating rooms were too busy. My daughter spent the night suffering from increased pressure on her brain. This was ignored by the nursing staff and the resident neurosurgeon, who failed to check on my daughter after she was placed in the room. From the time she was told she needed surgery to the time she went into respiratory arrest, no doctor ever examined my daughter. The hospital could have done a bedside procedure to relieve the pressure on my daughter's brain, but did not even attempt it. Unfortunately, Taylor passed away before her scheduled surgery. I share my daughter's story so that others will be inspired to advocate for patients' rights.